Local shows to serve our community and playing the 70s till now. SWR Triple 9.
The community show is made possible thanks to a grant from Sydney Water.
Good afternoon. It's 6 minutes past 12. We are listening to the community show on SWR Triple 9. And with us this afternoon is Dr. Kenneth Chan, one of the most feared and also misunderstood people in the world. A dentist. How are we all, gents?
Hi, Mitch. Hi, Steve.
Hi, Ken. Hi, Mitch. How are you?
Very good, very good. Now, Dr. Ken, thank you for coming over to the station. Now, I say a dentist is one of the most feared people because of the pain associated with high-pitched machines. Especially the sound when the pitch drops down. But that's old-fashioned now. We know technology's caught up and it's not that... For me, it's not painful.
No.
It's not painful. And now, he's misunderstood also. Dentists are misunderstood also because the pain associated with dentists can be avoided.
Yeah, that's right.
A lot of people don't know that. Now, we're going to go for a quick song break, and after the song, we've got some questions for Dr. Ken, which will help us put a sparkle with our smiles. Now, this is a very interesting song. This one's called Tiny Daggers. Believe us, ladies and gentlemen, we did not pick this song.
Not on purpose.
Not on purpose, but let's have a listen to In Excess with Tiny Daggers. Here we go.
SWR Triple 9, Sydney's West.
11 minutes past 12. This is Stephen Mitchell on the community show on SWR Triple 9 with Dr. Kenneth Chan. Hello, Dr. Ken. Now, everyone should know about this. What dental habits should everyone have?
Well, in terms of basic habits, we should all be brushing twice a day. Once in the morning after breakfast and once at night before we go to bed. And we should be brushing for 2 minutes and trying to floss actually every day or every second day. Those are the good habits that we should all have.
Wow, 2 minutes. I don't think I spent 2 minutes, but maybe I over-concentrate when I brush it. I'm not just concentrating on one tooth at a time, but one section at a time. I go left, up, down, middle, up, down, right, up, down, then on the inside repeat the process. So what basically, when we're brushing, what are we trying to get rid of?
We're trying to get rid of all the plaque, which is all really just all the leftover food scraps from our mouth. And along the gums as well.
Okay. Now, plaque. What is plaque? To me, it's fat from food. Is that what it is?
Well, plaque is just a mixture of the leftover food scraps, but also in combination with that is mixed with saliva. That's what plaque is.
Oh, okay.
So pretty much after every meal, you're always going to have plaque, and that's why it's important to be brushing regularly throughout the day.
All right, so when my teeth get furry, that means I've got plenty of plaque.
Exactly. It's not just because somehow the teeth grow fur. Yeah, it's because of plaque.
It's because of plaque. Now, I know you got some props here. Earlier on we were talking about what kind of brushes should we use, manual or electric?
Yep, that's a good question, Mitch. I get this asked a lot by different patients. Studies actually show that whether you use manual toothbrush or electric toothbrush, they both work just as well. What's more important is about the technique.
All right.
Yeah. So with manual toothbrushes or electric toothbrushes, as long as you brush into the gums and around each tooth carefully, you're going to do a good job of cleaning your teeth. What's, I guess, helpful with electric toothbrushes is that 2 minutes of electric toothbrushing is equivalent to about 6 minutes of manual brushing. So for people who might have a bit of manual dexterity issues, elderly people or young kids, that might be helpful for them if they find it hard to hold a toothbrush for long. But also maybe if I find that some patients actually brush too hard with a manual toothbrush, I'd then recommend using an electric toothbrush with a pressure sensor so they don't keep brushing too hard onto the gums and damaging the tooth structure or the gums.
All right, now this is going to be a bit of a joke, but I think some people actually do it. Some people just hold their brush and move their head, and some people are supposed to move their hand to go around the crevices in your mouth.
Yeah.
Steve, what do you do? How do you brush your teeth?
I don't know, just
Do you do both? The brush stays steady and you move your head around? Or you
No, I haven't heard of that. That's weird.
Well, we're weird people. Now, what about food and snacks at work? Because we're talking about brushing the teeth in the morning or twice a day.
Yep.
I know some people that when they get up, they brush the teeth before the meal.
Yep.
So should they be brushing after the meal? Oh, I know some people don't like the sleep breath.
There's the sleep breath, or even like tasting all your breakfast with a minty flavour.
Yes.
I guess what is important is to know that it's after food that we get plaque most. So ideally, if you can brush after breakfast, that'd be best. But if you do brush in the morning, it's already a good habit to have. If you brush in the morning and then brush at night, that's good enough. But preferably, from a hygiene perspective, after breakfast will be better.
Okay, after breakfast will be better. And what happened? What about at work? So the gap in the morning and in the afternoon when you come home, how do we address that one?
Yep.
For example,
so during the day.
During the day. So if we don't brush, is that all right? Can we wait till we get?
It is okay to wait. It's not like the plaque suddenly turns into tartar and gets stuck to the teeth straight away. But I guess good habits that you can have is just drinking water regularly after your meals or your snacks at work. The water will just help to flush the plaque off and wash the food out, and it helps to keep the teeth cleaner.
Yep.
And a little tip for the people who do drink lots of tea and coffee.
Yep.
You ever think about that cup of coffee that you leave sitting on the desk for a few hours?
Yes, and my cup is like that.
That could be your teeth, Mitch. If you actually rinse the cup straight away, very easy to clean that cup. Similar idea with our teeth. If we drink a bit of water straight after our tea and coffee, it helps makes a big difference in terms of keeping it whiter as well.
Well, there you go. Now, I've got a question later on about the color of teeth. But right now, let's go. We're going to have a quick song break. And after the song, we will ask Dr. Ken to give us an idea of what we can and shouldn't put in our mouth. Now, the song that we are going to play actually sounds like a food. Marshmallow. But that's actually the name of the band. Now let's have a listen to.
Are you sure you didn't plan all these songs?
It's a fantastic coincidence. Incidentally, I'm a sugar addict. So let's have a listen to Marshmallow, and the thing is called One Thing Right. Here we go.
SWR Triple 9 is Bosco for Brekkie. The 70s to now while you work. SWR Triple 9, Sydney's West.
The community show is made possible thanks to a grant from Sydney Water.
Marshmallow, One Thing Right on the community show, and we're talking about getting your dental hygiene right with Dr. Kenneth Chan. Doctor, we were talking about toothbrushes earlier. How should we select toothbrushes?
That's a good question, Steve. In general terms, what I always recommend is always using a soft bristled toothbrush with a small toothbrush head.
Okay.
What that allows us to do is actually brush into the nooks and crannies better, and we're not just glancing over all the teeth at once with a big toothbrush head. What I do find though is when I go to different supermarkets and chemists is I find out a lot of the toothbrushes they have there aren't actually good for brushing.
Oh, okay.
Maybe only 10% of the toothbrushes are actually helpful and useful in terms of brushing.
Is that because they're too big?
Yeah, too big, or even a lot of people find that they want to use a medium or hard bristled toothbrush.
Yeah.
But that's actually a bit too abrasive and can actually damage the gums and the tooth structure if you keep using that in the long term. So that's why I always just recommend soft bristles or super soft bristles. I actually brought a demo.
Yeah.
If I can actually I'll actually open up and let you have a feel of it.
Yeah. Well, this is radio, so but, we do.
You can have a feel of it.
Just have a touch of that toothbrush bristle.
Yep. Yeah, that's nice and soft. And,
that's actually really gentle, and that's what we want in terms of the toothbrush.
Yes.
Yeah, just a quick question. We mentioned about the size of the toothbrush.
head,
Is it
yeah.
because there are different sized people, or some have bigger mouths than other? I'm talking about relatively.
I
speaking.
suspect that some people might just want a bigger toothbrush head because they're maybe a bit lazy. A bigger brush, clean quicker. But yeah, like I said, if it's too big, you don't clean the teeth properly,
Okay.
especially the back ones.
Yeah, it's not going to fall into the gaps.
Food and snacks at work. Tell us about what we should do there.
Okay, that's a good one. In terms of food and snacks, we don't want to be grazing throughout the whole day. Essentially, if we're grazing on, especially sugary or acidic foods and drinks the whole day, you're essentially feeding all the bad bacteria in your mouth for the whole day.
Yeah.
They're feasting, they're partying in the whole day. That means there will be more bacteria compared to if you only just had a small portion, maybe at 10, 11 a.m. during morning tea,
Yeah.
and then stop, and then maybe in the late afternoon, 3 p.m. and stop again.
Yes.
Breaking it down into smaller portions and not throughout the whole day helps to keep the teeth healthier and the gums healthier. But also minimizing the amount of sugar you eat as well can make a big difference.
Yep. I read in your notes here, it's not should we or shouldn't we, it's minimizing them as well.
Yeah, so I have a friend from church who is a dietitian. She's got a PhD. I see her eating chocolates, cakes every now and then. But what she always says, it's about balance and moderation.
Yep.
Yeah.
We can't have too much, but at the same time, it's not like we can't have any.
Yeah.
Is there anything we should do after having the snacks and sugary drinks in terms of food, teeth?
Yeah, after snacks and drinks, having some water, plain water is great for the teeth.
Yep.
Washes the plaque out, keeps the teeth nice and clean, and also just hydrates your body as well. Because often with particular foods like maybe chips,
Yep.
they just dry your mouth out, and with less saliva and a dry mouth, once again, the teeth and the gums are under attack from the snack.
Yeah. If anyone's out there thinking, I've got bad teeth because my teeth are yellow, do they, or?
Yeah, that's a good question. I would start off with saying that kids' teeth and adult teeth are quite different in terms of composition. Kids' teeth actually look whiter than adult teeth, and that's normal.
Yep.
Once a parent sees their kids' teeth falling out and getting the adult teeth, they will notice a more yellow composition or colour on the adult teeth. But also, it depends a lot on our diet throughout the day and over the years.
Yep.
People who do smoke more, drink more coffee and tea and wine tend to have more discoloured teeth or yellow teeth, so to speak.
Yep.
People who do eat a lot of foods with colourings in them, like curries and pasta sauces, they can also stain the teeth a lot more.
Yep.
But bottom line is, it's not that we can't have any of that stuff, but it's how we maintain our teeth straight after, which makes a big difference in the long term to keeping the teeth whiter.
Yep. So, bottom line is whiter might not mean healthier.
Yeah.
Yeah. And if in doubt, maybe try and get some, or speak to a professional about that. We're going to go to a song, and after that we'll continue the chat with Dr. Ken. It's Matchbox 20 and 3 a.m. You don't want to be awake then thinking about your teeth. SWR Triple 9.
This is SWR Triple 9 Sydney's West.
30 minutes past 12. We are having a chat with a dentist, Dr. Ken. Now, that song was Matchbox 20 with 3 a.m. Now, as a reminder, and I'm sure Dr. Ken will agree with this, when you come home from a party at 3 a.m. before you go to bed, brush your teeth.
Definitely.
I don't think you're going to be wanting to brush your teeth then.
Well, it's about forming habits. Very good segue, Steve.
Yeah.
Because now, as parents, how early should we start kids brushing their teeth?
Pretty much as soon as you see your child start teething. That can be as early as 6 to 8 months for a baby.
Okay.
You don't have to use a toothbrush for a young baby like that. You can try using their little finger brushes that you can buy for babies, where the parent just puts the little finger brush on and then just gently massage and brush the teeth. Starting from as early as 6 to 8 months.
All right, I think you did mention this earlier on in the program about protecting the gums as well. So
Yeah.
it's not just about teeth; it's also about gums.
Yeah.
Now, how do we make children and everyone really get into the habit of brushing?
It's about motivation, Mitch. I guess whether it's an adult or child, you want to find out what actually motivates them to brush their teeth and explain to them the importance of it. I was chatting to my friend a couple of weeks ago, and he was telling me his 4-year-old boy started asking why about everything. And one of them was like, "Oh, why do I have to brush my teeth, Daddy?" And his dad said, or his dad asked him, "Do you like eating food, James?" And he's like, "Yeah, of course I like eating food." And then his dad explained, "Well, if you like eating food, you need to look after your teeth. If you don't look after your teeth and brush them, you'll get bad germs and bad bugs which hurt your teeth and damage them. And then you can't eat yummy food. Do you want to?
That's right.
Do you not want to eat yummy food?" And the son got it straight away, and that is what my friend found to be what motivated his son. And I guess for everyone, that motivation might be different. For teenage boys, it might be actually telling them, if you don't brush your teeth, how are you going to ask that girl out on a date? Do you want that bad breath? Because you haven't been looking after your teeth for. Or maybe for the uni student or young worker, like who's applying for that job, do you want that kind of stained tooth or bad breath hovering over you when you do your interviews?
Yes, now we mentioned the color of the teeth before, and I'm going to ask this question again. Steve's already asked it. Now, is the color of the teeth from white to my teeth are yellow? Now, when I was younger, I was told that your teeth are yellow because you have a lot of calcium, and that's what happens. What is it? An indication of health? Teeth health?
It's not always an indication of the health of the teeth. It can be an indication of how well you do brush. Generally, it should look a light white with a tinge of yellow. But if it's more than just a tinge of yellow, it might be time to go visit your dentist to investigate what's actually happening. It may just be from staining over the years, needing a clean. But it may actually be a bit of or maybe too much plaque or too much tartar, which can actually be quite damaging for the teeth.
All right, so the stain on the teeth is not only from colored food like coffee or lolly water or anything like that. It can also be from a build-up of
plaque and tartar.
And tartar. Now we know tartar's from smoking, and plaque is just from general food consumption.
Tartar's actually a build-up of plaque that's actually hardened.
Oh, okay. And
so what we want to do when we're brushing and flossing, Mitch and Steve, we're trying to get rid of the plaque from the gum line and between the teeth. If we don't completely remove it, that plaque actually calcifies and turns into tartar. See it sort of like plaque being like soft mushy cement that you can wash off and brush off. Once the cement's set, you can't brush it off anymore. You need a jackhammer.
That's right.
That's what the comes in. Yes, and it's not like dentists like getting rid of that for you and making that noise, but it's what's necessary to actually maintain the teeth and keep them healthy.
Okay. Now, this is controversial for some. Now, how much toothpaste should we actually use?
This is good. We should really only just be using a small pea-sized amount or less. I see a lot of people squeezing a whole row of toothpaste out onto the toothbrush. But in reality, we only just need a small pea-size or even a small rice-sized grain amount of toothpaste. So
practically what? So toothpaste is just for flavoring then?
It's There's fluoride in the toothpaste.
Okay.
And it's the fluoride that we want to help to protect the teeth and keep them strong and protect from tooth decay. Fluoride helps by actually strengthening the tooth structure. Studies actually show that teeth with fluoride in the structure of the tooth is actually stronger and more resistant. And fluoride actually also helps to disable or slow down the activity of bacteria, which actually cause tooth decay as well. And that's why we do have fluoridated toothpaste and fluoridated water in the water system. But it's not like we need to have too much of it. It's just small amounts that can help with protecting the teeth from tooth decay.
All right. So when this flavor that we get from toothpaste isn't exactly the fluoride. Does it have a flavor?
The flavor is just what they add into the toothpaste ingredients, just to make it nicer to brush your teeth with. That's why they're like, when you go to the supermarket, there are like 25 different flavors you can choose from, and the patients ask me, "Oh, hey Ken, there's so many choices. What do I choose?" I just say, whatever flavor you like.
Whatever. And some have even 3 colors to it. To
make it look pretty.
To make it look pretty. So it's all just advertising, but the reality
maybe it's like you said. Maybe it's like you said earlier, to motivate you to brush your teeth.
Yeah, like we're all different. We all have different habits and preferences. And if the marketers actually make 5 different flavors for 5 different people who prefer different flavors, so be it. Whatever helps.
Yeah.
Now, is brushing enough? Now, I floss.
Yep.
Now, floss sounds to me like cotton candy. I can go to a particular shop and buy a floss with a pick on one end and a floss on the other. It looks like either, depending on what you do, a little shaver or no. Do we need to buy that?
Flossing is important. Essentially, if you don't floss regularly, you're not cleaning about 30% of your tooth structure.
Okay, that's in between the teeth.
Yeah, in between the teeth. That accounts for about 30%. And if you think about it in the long term, do you really only just want to clean 70% of your teeth in the long term? What can happen is you end up losing 30% of your teeth if you don't floss regularly in the long term. Essentially because when we do brush with a toothbrush, the toothbrush bristles won't go into all the nooks and crannies between the teeth.
Yeah.
And that's where flossing is very helpful and important. There's actually a dental joke that says you only floss the teeth you want to keep. Now,
what happens if we miss a day of brushing our teeth?
It's not a life-threatening situation, so don't be worried about that. But I guess it's the longer you leave your teeth unbrushed, the longer you allow the bacteria or the bad bacteria in your mouth staying there and feeding on the little bits of plaque and food that are trapped inside the mouth and along the gums and in between the teeth. So the longer you leave it, obviously, the higher chance you can get infection or tooth decay.
Sometimes I do get lazy and I just run my tongue over my teeth and feel for fur because I just want to go to bed. Now, when is the best time to brush our teeth?
Ideally, before going to bed, probably like a half an hour before and probably half an hour after eating. The reason why I say after eating for half an hour is sometimes you might have some acidic foods and drinks which can damage the tooth. When the acid's on the teeth, it's actually in a sort of like
active stage.
Yeah, active stage.
Yeah.
And you don't want to brush your teeth away because that can wear down the tooth structure quicker. And so by allowing that half an hour wait, you're just allowing the acid to wash away and settle the tooth down before brushing. Okay,
so the habits that we want to keep is after you have a feed, rinse your mouth with water, gargle or whatever, and then before you go to sleep, brush your teeth. Now we're going to go into a song break. This is Bohemian Rhapsody with Queen.
Local shows to serve our community and playing the 70s till now. SWR Triple 9.
The community show is made possible thanks to a grant from Sydney Water.
14 minutes to 1. We are with Dr. Kenneth Chan now. Thanks for joining us here at the Guinea Show on SWR Triple
Thanks for
9.
having me.
Yeah, you're welcome.
A bit of Queen there and Bohemian Rhapsody. Dr. Ken, we take it for granted breathing and a good night's sleep. Does that also correlate with good dental hygiene?
It actually does. Breathing actually has a very strong influence on how a child's jaw develops and grows, and as a result of how the jaw grows, how the teeth come out.
Yeah.
Essentially, what we actually know now from scientific research is we should all be breathing through the nose. The nose is for breathing, the mouth is for eating.
Yeah.
The mouth should not be for breathing. And when we actually nose breathe all the time, the mouth is closed and the tongue would actually posture up onto the roof of the mouth. And that actually helps that upper jawbone to grow forward and sideways. When a child is breathing through the nose all the time, their jaw will naturally be big, and when their teeth come out, they all come out naturally straight. But if for whatever reason a child can't breathe through the nose well, might be from large adenoids, large tonsils, allergy problems, then they can't breathe through the nose. What they use the mouth, and that then compromises the growth of the jaw because the tongue can't posture the jaw to grow bigger, and you end up having smaller jaw, higher chance for crooked teeth, and as a result of the poorer breathing habits, you don't sleep as well. When you breathe through the nose, you actually get better quality oxygen going into the body, into the lungs. When you're mouth breathing, you don't get that quality oxygen and not enough oxygen, so your fuel tank's always half full. And so when you wake up, you feel tired, you don't want to wake up. When you go to school or when you go to work, you just feel lethargic, and by the afternoon you just want to take a nap. That's how breathing and having good sleep is actually related. And that's why when patients do come to me now, it's an important thing of what I look at to help not just address their teeth problems, but also their breathing and sleeping problems. If I am concerned, I send them to a specialist to have their airways looked at.
Okay, now earlier on, you were talking about money-saving ideas. One was how much toothpaste to use. Now, in a general public, now how can the homeless and the financially disadvantaged people and their families keep their teeth healthy?
So it is quite commonly informed to a lot of people that we should be changing our toothbrushes every 3 or 4 months, and that's true. As soon as your toothbrush gets splayed out too much, you've got like the Michael Jackson hair flies out everywhere. When you see a toothbrush like that, ideally you do want to just change it to a new one. But if you're in a situation where you can't actually get toothbrushes regularly bought, having a toothbrush that's splayed out is better than not having a toothbrush at all. And what I've actually noticed is also, I've mentioned before, using less toothpaste. What I noticed when I got married was my wife used 2 or 3 times more toothpaste than what I actually use myself. And
I guess that's the habit then.
It's that habit. And if she actually used what I use in terms of amount of toothpaste, that would save her 2 or 3 tubes of toothpaste. Just by using less.
I guess it's because people think maybe in that situation more is better, sort of thing.
Well, I guess like we want to actually strike that balance of what's actually just adequate and not going overboard. And what I actually want to suggest as an idea for those who actually can't afford floss, and especially for those who might be homeless. I learnt this from a patient of mine when I was working in public health, and what I asked her was, do you floss regularly? And she goes, yes. And she was actually like, but I actually don't use floss, I use plastic bags. And what I actually found out was she actually cut
them into strips,
plastic bags into strips,
and
flossed her teeth with the strips of plastic bag. And I actually, very honestly, tried it out, and it works.
Yeah,
It's not going to,
of course.
obviously, try to keep the plastic bag clean.
Yeah.
And that if you want to actually floss your teeth, and you can't afford floss, finding a plastic bag that's clean and cutting into strips can be an option. I'm not going to say it's the first option, but it can be an option for those who can't afford that.
Yeah.
Okay. Now, when I visited you at your practice, now I was
Yeah.
complaining about one of my lower teeth jutting out, and you mentioned something about my jaw. Now, what happens to our teeth and gums as we age?
So, as we age, our jaws and jaw bones can shrink in size, but the teeth remain the same size. So what can end up happening as we get older is we notice our teeth getting a little bit more crooked, and
Yep.
some teeth kind of getting bumped out of position, and that's the main cause of what causes that.
Yep.
And can you tell us what types of food are Can you tell us what types of food are teeth and gum friendly?
Yep. Obviously, non-processed foods are better. Organic, natural foods.
Yep.
The way I always describe it is, how do you want to build your house? If you want to build a good house, you want to give good quality materials that actually help to build a house.
Yep.
If you feed your body with lots of junk, you're going to build a junk of a house and junk of a body. Particular foods might be cheese. Cheese has lots of calcium and protein in it, and it also helps to reduce the amount of acid in the mouth. Hard veggies and fruits like carrots, apples, celery sticks help to work the jaw muscles, but also helps with giving fibre, which keeps the gums healthy.
Yep.
And those harder foods actually also help with cleaning the teeth.
Cleaning the teeth. Yeah,
You think about, yeah, it actually is. You mentioned earlier, Mitch, with like cleaning your teeth with maybe like a coconut.
Yeah, coconut husk. Yeah.
Same idea, like having something harder and firmer as we're chewing
Yeah.
helps to clean the surfaces of teeth better than soft foods.
All right. Now, Dr. Ken, now, thank you for coming over. We're just about out of time now. How do we select a dentist?
Great question.
Trick
I'm
question,
not going to
huh?
plug myself. But what I think personally myself is important, having a dentist that you're comfortable with.
Yeah.
Not everyone's going to be comfortable with every dentist, so finding one that you're comfortable with, but also finding one that you can actually ask questions and approach. A lot of patients of mine actually find that the previous dentist didn't find them very approachable or didn't explain things. Having someone you can approach so you can actually honestly ask how your teeth are going and what you can do to improve it rather than feel judged is really important to finding a dentist who will be with you to look after your teeth and your gums in the long term.
All right. Well, I'd like to thank you once again, Dr. Ken. Now, early on we mentioned that there will be a dental health week sometime next year. What was it?
I think around August.
Around August. So we'd love to have you back again in August.
Yeah.
Now, ladies and gents, it's 5 minutes to 1. And again, I can't say thank you enough, Dr. Ken, one of the most feared professions in the world, a dentist. Now, Steve does Toastmaster. Now, he's a Toastmaster. I call you a Toothmaster.
Thank you, Tim.
Now, to take us out, like I said, we didn't I can't even get that out of my mouth. We didn't intentionally pick this song, but this last song is by Shannon Knoll. This song is called Shine.
Shine bright.
Thank you again. Hooroo.
Thank you.
Thank you.
SWR plays the 70s till now while you work and local shows for the whole community. SWR 999.